PCD is a difficult disease to diagnose, partly because of the lack of awareness. If you're not looking for it, you're not going to find it. People go decades without a diagnosis. Primary Ciliary Dyskinesia is a genetic disorder that affects the lungs primarily, but the cilia lining the upper and lower respiratory tract, along with other tracts in the body. Basically, the cilia don't function properly, so there'll be a buildup of mucus and bacteria, and in most people, that's cleared automatically. For PCD patients, we have to do it manually. So we actually have to bring the mucus up. And even in doing so, that buildup of mucus will be a breeding ground for bacteria and infection. As time goes on, eventually you're going to get sick. With that would come oral antibiotics, which were very effective early on. That's no longer the case. There's a resistance built up to them over time after taking them for 2 decades plus. Upper and lower respiratory congestion, increased cough. I bring up mucus on demand at any point, 365. That's just baseline.
Breathing.
So I'm always coughing. So when I don't feel well, it's always compared to baseline. So I'm coughing more than I typically do. I'm more congested than I usually am. I'm wheezing more than I typically would. There's not a one-size-fits-all approach. It's a broad spectrum disease. It affects people very differently.